Happy Easter! Yes, this is Easter Sunday, April 12th, 2020. And we are bringing you this coronavirus update episode from Arlington, Virginia. My name is Heerak Christian Kim. I'm an independent candidate for U.S. Congress in Virginia's 8th District. That's Arlington, Alexandria, Falls Church, and Fairfax County. And today we are going to talk not about eggs, but what comes with eggs: bacon and pigs and pork. Today we have an exciting episode to kind of discuss what's going on uh, and to understand what's going on. Because if you do not know what's going on, you may not be able to survive coronavirus pandemic. Knowledge is power, and that is why we have created this program for you, Coronavirus Update by Heerak. And this will help you and your family survive coronavirus pandemic. So let's get started. In the last 24 hours, we have had 1,469 deaths, so around 1,500. So the 5-day streak has been broken. For the 5 days during Holy Week, there are around 2,000 deaths. So there are about 10,000 deaths during Holy Week, actually more because it's more than 5 days in a week. But for 5 days, there were around 10,000 deaths. Today is Easter Sunday, and we see that God has shown a little bit of mercy. So the death rate has dropped down to around 1,500. So we have 500 less death than we had yesterday, which had around 2,000 deaths. So, in a way, I guess we can say this is God's way of celebrating Easter with us. But our death toll continues to go up. Yesterday, April 11th, there were 20,604 deaths. It went up by 1,469. So that is up to 22,073. Confirmed cases are going up around 30,000. So yesterday we had 529,740. And today it went up to 556,044. Hopefully the number of deaths will start going down. But we can't say for sure because it's one day. There were 5 days when it was around 2,000. And today being Easter, maybe it's a one-day kind of reprieve. We'll see what happens tomorrow. So tune in tomorrow. Subscribe to this YouTube channel so you can always get updates. So today what we're going to do is we have been really looked at the top 5 ranking of COVID-19 deaths in the United States for a while. So I thought, let's go back to that and see what's going on. New York is still number 1, and their total death is at 6,898 deaths, which is about double the number of the total death that China suffered as a country from November to now. So that kind of puts it into perspective. Coronavirus outbreak started in China, but New York City, which is a one little city in America, it's not a little city, but compared to China, which has over 1 billion people, and they have a lot of cities that are in the millions. Just one city, we have 6,898 deaths. So that's tragic. But what's more tragic is that suburbs or the counties around New York City are beginning to see a hike in deaths. We remember when New York used to be at 846-ish deaths. Now we see Nassau County, New York, is ranked number 2 at 846 deaths. And it is possible Nassau County may go up to the number of deaths that New York has. We just don't know yet what's going to happen. But the numbers are definitely going up. But an interesting thing is number 3 is city of Wayne, Michigan. It's climbed all the way up to number 3, and it has 704 deaths. But that's the only exception to the rule. You see number 4 and 5, they're both counties in New York near New York City. Number 4 is Suffolk County, New York, and the death rate is 518 deaths. Number 5 is Westchester County, New York, at 511 deaths. And as you know, Westchester County is where Facebook founder Mark Zuckerberg is from. So he probably has a lot of friends and relatives there. He went to Phillips Exeter Academy for high school, but he went through the school system in Westchester before that. And so hopefully, none of his relatives or friends have died, but it's possible, 511 deaths. That's a lot of deaths. And seems like the rates are going up. So we don't know if Westchester as well will hit death rate similar to New York. Westchester is interesting because it's like Virginia 8th District. Westchester has a lot of wealthy people. So just like Virginia's 8th District, which is Arlington, Alexandria, Falls Church, and Fairfax County, is near Washington, D.C. And it has a lot of people who make over $150,000 a year. And so it's kind of like that in Westchester County, New York, a lot of wealthy individuals and wealthy households. Education level is very high, just like in Virginia's 8th District. A lot of people go to college, just like in Virginia's 8th District. So that's somewhat disturbing to see because there are so many similarities between Virginia's 8th District and Westchester County. And so we'll see. I mean, it's possible that Virginia's 8th District become like Westchester County in terms of having an outbreak that starts to spread. If you recall, Westchester was nowhere on the map in the rankings a while ago, but somehow it came back from behind and it took its 5th place. So that could happen in Fairfax County, which actually has outbreaks. Right now, Arlington is beginning to see more cases, and Alexandria had its first case recently. Falls Church is beginning to see cases grow, so we don't know. Washington, D.C. Mayor Bowser said that she expects the peak to hit Washington, D.C. in June. What that means is death rate is going to keep continuing to climb until June. And her prediction is that it will start to go down in June. Obviously, that's not guaranteed. But the important point for us is she's expecting, based on people who do research for her, like Washington, D.C. Department of Health and experts in D.C. area, that cases and death rate in D.C. will continue to rise until June, until Mayor Bowser thinks will hit a peak in June. That means April and May will see continuous rise or even a very steep exponential rise in death rate in Washington, D.C. And it's nearby areas like Arlington, Alexandria, Falls Church, or Fairfax County. Let's see if she's right. I mean, we know that cases are growing and death rate is growing in Fairfax County and other areas around here. So it's possible we're going to see an exponential curve. So the Easter that we are celebrating today with all these eggs, and hopefully you had a happy Easter egg hunt today with your children and celebrated Easter in a special way. Because if you are one of the unfortunate ones to get coronavirus in the next 2 months and die, then this Easter is the only Easter or the last Easter that your children will remember you by, or your grandchildren will remember you by. So hopefully you did some fun stuff with them on Easter, and I'm reporting to you on the evening of Easter. Generally, the programs are aired in the evenings. But hopefully you did something special with your children. I mean, coronavirus is horrible, and there are a lot of bad things going on, but you have to focus on your children because you may die. Let's face it. Look at New York. Do you think 6,898 people in New York City expected to die? No, but they died, which means the only memory their children, or the last memory that their children will have, or the only really strong memory that their children will have, especially if they're very young, like 3, 4, 5, 6, 7, 8, 9, 10 years old, will be from this week. Especially for those of you who have children who are under 10 years old, just remember, just because you're in 30s or 20s or 40s doesn't mean you're not going to die from coronavirus. You can die. Sorry to be totally downer about this, to use a colloquialism, but people are dying. People in their 20s are dying. People in their 30s are dying. A lot of people in their 40s are dying. If you're obese or have diabetes or other health conditions, if you're in 40s, there's a high chance that you will die if you get coronavirus. Especially with a lot of individuals marrying late due to professional struggles or greed. We have a lot of people with young children at a relatively older age. So some of you may be in 40s and have children under 5 or under 10. And you have to make sure that you give them good memories from this time, because you can die. We just don't know. And Dr. Fauci was saying that he expects a second wave to come in fall, like in September, which means you're going to have to start this all over again, but sooner, because we started like in February, March, but this time it's going to start in September, and you're going to have a longer period, which is something to really worry about, because it's going to start like in the fall, like September, October, November, and then you're going to have the whole experience. And there's no guarantee that there will be less deaths for 3 reasons. Number one, there is no vaccine. Antibody experimentation by dozens, maybe hundreds of people around the world have all failed. There's a high chance they're going to continue to fail. Experts say the earliest vaccine will be in 18 months. And so there most likely will not be a vaccine in September, October, November, when this starts back up again. If Dr. Fauci is right in saying the second wave will come in the fall. And since it's a longer period, more people will die. And not only that, remember, your immune system might have suffered during the first wave because you are now at home and maybe you're not exercising. All the gyms are closed, so you used to go to gym every day or every other day to work out for an hour, but now you're not doing that, which means if you're in your 40s, 50s, even 30s, even late 20s, your body's degenerating right now as you watch this program, which means by the fall, your immune system will be weaker, your body will be weaker, which means death rate will probably be higher. So that's a major factor to understand. And those are kind of related categories. Number two, There is a chance that virus can mutate. All living organisms adapt to survive. That's just a basic principle of science relating to living organisms. Think about yourself. When you encounter a problem at your work, what do? You try to figure out ways to survive, whether it's problems with your boss, maybe it's problem with HR, human resources, maybe it's problem with some bully among the coworkers, whatever it is, you're trying to find a way to survive because you're a living organism. And that's what living organisms do. They try to survive. In the same way, COVID-19 is a living organism, and its prime directive in, its life, is to survive, which means it has to find the host. Uh, it's a RNA virus, which means it has to find the host, attach itself to your body's own DNA sequencing mechanism, and then replicate inside your body through your own DNA system. So RNA virus like HIV or COVID-19 becomes part of your own body. It hijacks. The technical term is hijacking your DNA reproductive system, so it replicates through your system. So it's not growing on its own. It latches onto your DNA sequencing system, and whatever your body, when your body is multiplying its cells, it uses your body system to multiply. And that's why a lot of people are dying, because the virus is multiplying inside your body and spreading all over your body. And the problem is it's not a bacteria, so there's no antibiotics. Like if this were a bacteria, then you could take some antibiotic and it will help kill it. But there is nothing that will kill it. Nothing. There is absolutely nothing that kills the virus. Nothing. President Trump is hoping and guessing and theorizing that some treatments will work. Dr. Fauci is highly doubtful of that. If you saw Face the Nation program, he talked about it. Yeah. So as of now, at least in terms of 100% positive certainty, there is no cure. Some things may help, they may not. We just don't know. Experts don't know. So a virus can mutate and become more harmful in order to survive better, right? Because they want to multiply, and right, that's what all living organisms want to do. They want to multiply and dominate. And so COVID-19 may go through mutation sequences from now to the next season, thereby becoming more of a killer. Right now, a lot of children are not dying from COVID-19. In the second wave, they may kill children more effectively because they have mutated in that direction. It's possible. I'm not saying that's going to happen, but anything is possible. And I'm sure the experts will back me up on this. Cells can mutate, viruses can mutate. And you could do your own research on this. Now, British experts are saying that there's going to be a second wave and a third wave in rapid succession. Now, Dr. Fauci has only talked about the second wave. He hasn't talked about the third wave, and maybe somebody can ask. Dr. Fauci believes that second wave will be more deadly than the first wave. Most scientists believe that, just because of the trending of pandemics. Well, let's see. Let's see, whether Dr. Fauci is correct. And obviously, we're going to have statistics. If there is a second wave, we can compare the statistics and see which one is more virulent. Obviously, we will be hundreds of thousands or even millions of Americans less, since they probably will die if it's much more virulent than this. Can you imagine? During the Holy Week, 2,000 people are dying per day. Maybe in the second wave, you may have 4,000 or more, 10,000 dying per day. during the Middle Ages, during Black Plague, 9,000 people were dying per day in a given location. So you see, New York only has 6,898 deaths. I say only because compared to Black Death. Black Death killed 1/3 of the Europe's population. 1/3 of everyone who was alive before Black Plague died. And we don't know, but no scientist would deny that that could happen with COVID-19, with second wave, third wave. No one knows. No one knows what's going to happen. For all we know, the worst case scenario is 1/3 of the world dying from COVID, second, third, fourth wave if no vaccine is discovered, and if the virus mutates, in a more negative killing direction, because virus can mutate toward being more harmless, which is less likely. As I have said, in evolution, generally living organisms adapt to survive. So the principles of adaptation in science would argue that living organisms will become more powerful, more virulent in order to survive. But you have other intervening events that could weigh into that. For example, dinosaurs were very powerful, but either because of meteor that hit United States or the world. At that time, obviously, there was no United States back then, or an ice age, or ice age melting. Whatever the reason might have been, dinosaurs died out, and so there may be some kind of act of God that could kill off the coronavirus. Obviously, if God is merciful to send such an act of God. But you can't count on it. I mean, this thing can go for years, and just like flu comes back every season, it could come. I think Dr. Fauci mentioned in one show that this could go on forever. Only way it's going to be killed off is if we have a vaccine. So I think he said that. So it's like the virus will continue to exist until the end of time, until Jesus Christ comes back. But the difference is if we have a vaccine, then no one would, and if it's a foolproof vaccine, obviously, we don't know if it's going to be foolproof, but, that would reduce the death number by a significant margin. So as of now, we don't know what's going to happen. And look, everything is closed. So this is not a normal flu. And Sky News, you should see Sky News. They have some good programs that are filmed in Italy. And one of the Italian doctors said, this is not like a flu. It's more like a killer pneumonia. So maybe we shouldn't be talking about COVID-19 as a flu-like thing, but rather a pneumonia-like thing. But anyhow, so there is that's a second way more people could die. Now, third way more people could die is not anything directly to do with the virus or the second wave per se, but it is related. And I will tell you what I mean by that. Food shortage in the USA. Now, this may seem like a chapter out of a fictional book, but it is not. United States of America may be facing a food shortage crisis. Now let's look at the articles because we need proof. In whatever we do, we need proof. We need evidence. We are educated people. Anyone who's received an elementary education should be able to ask for evidence and be able to read the evidence. Most articles are written at elementary level or middle school level. So a good reader in elementary should be able to read any of these articles. And doctors and nurses are encouraged to speak at the 5th grade level. So if you have an elementary school education, you should be able to think critically and operate within any societal structure, because that's what we try to do. We try to include as many people in the information, because the government cannot explain it over and over again to everyone. Different people have different levels of education. So whatever material that government sends out to the public, they try to make it around 5th grade level so everybody can understand. Now let's look at the first article. That's the most recent article that came out in Easter. Smithfield closes South Dakota pork plant due to coronavirus. Hundreds of people in South Dakota's pork plant have been diagnosed with COVID-19. Now, we don't know if how that started. It might have been a manager who might have flown out there, because Smithfield is a Virginia plant. So maybe somebody from Virginia who flew out there brought the COVID-19 with them and gave it to everybody in the plant. We're talking about hundreds of people getting it. We don't know. But people fly, people travel. So virus hijacks your DNA factory in your body. And so you are now the vector, right? You go there and you're going to transmit your virus. Let's say you don't have any symptoms. You may not have temperature, but you could still carry the virus. You could infect other people with the virus. And maybe that's what happened. We just don't know. And this was reported in U.S. News and World Report and in other publications and in TV media. Couple days before that, Colorado meatpacking plant with thousands of employees closed after coronavirus outbreak. That was reported by CNN and by Steve Macy and Raja Rajek. And so there were dozens of people who had COVID-19 in the factory, so it closed down. Tyson shutters Iowa pork plant amid COVID-19 outbreak. That was from a few days before then. As you know, Tyson is a very famous company, produces a lot of good meat. And they shut their plant down in Iowa. And so we see this happening everywhere. And all of them are Midwest states. Colorado is, I believe, considered the Midwest state as well. So that's troubling. There's a lot of farmers are in the Midwest, and a lot of packing plants are in the Midwest. So let's say farmers produce stuff, and Secretary of Agriculture Perdue is he's like a coach. He says a lot of positive things, and I'm sure he's encouraging a lot of Americans. He's saying farmers are producing a lot of stuff, and I'm like, praise the Lord for that, because without food people die of hunger. And that's the third thing that I think could happen with the second or third wave of coronavirus, especially if COVID-19 pandemic is continuous, meaning it doesn't really stop. It just continues on for over 18 months or longer, as some experts are saying. Many experts are saying, actually. Farmers may have all this crop, but if the packaging factories and plants do not have workers to work them, the food is not going to be packaged. If the food is not packaged, it's not going to get to your Walmart, your your Giant, um, your local grocery store cannot receive food if it's not packaged. So it has to be packaged. Um, and so that's a problem. And also, a lot of food is processed in factories. And so if the factory is closed because workers are getting COVID-19, then you're not going to have food. Did you know that in Africa, there are a lot of land that are very fertile? They say about 70% of fertile land in Africa doesn't get farmed. Part of that is because of the wars that continue. My cousin is a Christian missionary in Sierra Leone, and he's been there for most of his life. Since graduating from seminary and marrying his wife, he's went to Sierra Leone. So he's been there for a long time. All of my nephews and nieces that are his children have grown up in Sierra Leone. They know Africa better than they know Korea. Their mother and father are both Koreans. They're both Korean citizens. And because of the civil wars in Sierra Leone, my cousin, the Christian missionary in Sierra Leone, had to flee to Ivory Coast. And then he did his missionary work in Ivory Coast while there was civil war raging in Sierra Leone with a lot of people dying. Korean missionary agents are a little bit different from American missionary agencies. They do not bring people home when there's violence in the area. They send them somewhere else. So Korean missionaries, whenever there's violence, they're going to be redistributed in other areas. So, so my cousin went to Ivory Coast as a missionary, and this war started in Ivory Coast when he was there. So he had to flee to another area because they were targeting foreigners. So he had to go to another area in Africa because the Presbyterian Church of Korea Missions Board in South Korea would not let him come home. And they should not. Obviously, you don't become a missionary to live in luxury, right? When you become a missionary, you're sharing the gospel, you're trying to make disciples of all nations, you're risking your life. But there are a lot of good missionaries as well in America. Reverend Bruce Hunt, I talked about that in previous episodes. Reverend Bruce Hunt was an Orthodox Presbyterian church missionary to Korea. And he was there when Japan came to occupy there was no South Korea, North Korea at that time. Japan occupied Korea, and the Japanese occupation of Korea was 1910 to 1945. 35 years of Japanese occupation. They forbade Koreans from speaking Korean language in public. They forbade teaching of Korean in Korean schools. Even though all the teachers were Korean, it was illegal to teach Korean. If you taught Korean language, you were arrested. So yeah, so that happened for like many years in Korea, 35 years of Japanese occupation. And Reverend Bruce Hahn was in Korea at that time. He didn't come home to America. He suffered with the Korean people. And I think it's his son-in-law, Ned Stonehouse, became a professor at Westminster Theological Seminary. I don't know if his first name is Ned, but Professor Stonehouse, I think he was a professor at Westminster in Philadelphia, and his children went to my school, Philmont Christian Academy. A lot of Orthodox Presbyterian Church pastors, elders, missionary children went to school at Philmont in Philadelphia. No, it's more like Erdenheim, PA. suburb of Philadelphia in Montgomery County, Pennsylvania. But anyhow, so there are a lot of good missionaries in America as well who embrace death to share the gospel, Christian gospel, to convert non-Christians, people of other religions, to Christianity. So there are a lot of good Christian missionaries in America as well. But anyhow, going back to where we are, food shortage may be coming to the United States. Nobody's talking about it. People are talking about plants closing. CNN, U.S. News will report Farm Journal Pork, which is like a industry-specific kind of a publication meant for people in the industry. They're not really talking about a food shortage yet, right? But here you go. Heerak Christian Kim brings you in his program, COVID-19 update, something to think about before it happens. Obviously, that's hindsight is 2020. Everybody knows once it happened what was needed. The important thing is to know before it comes. And this is where I help you and your family. I help the US government. I help President Trump. I help Senate, House, Governor Northam, because I give them ideas. Information is the gourd of 21st century. Did you know that? Goldman and Sachs made their billions because they trade in information. Information is the gold of 21st century, and I'm giving this information to you. So you should religiously see COVID-19 update by Heerak Christian Kim, who's running for US Congress in Virginia's 8th district as an independent. So vote for me on November 3rd, 2020 at general elections in Virginia, because I am a problem solver and I have all this education, and I've shared what kind of education I have in other episodes. And I'm going to use all this knowledge. I'm an expert of Jewish studies. I'm an certified expert of education, literally. I'm a licensed teacher in Virginia, South Carolina, Washington, D.C., Tennessee, Alabama, in all subject areas, math, English, science, and history, and ESL, English as second language. And in DC, I'm licensed as special education teacher. So I bring information. There's probably nobody as educated as I in all of Virginia, literally. So I have all this information I'm bringing to you. Information is gold. I'm giving this gold to you. Why would you want to miss my COVID-19 update by Heerak program? I mean, do you want to throw away gold? Are you so rich as to throw away gold? I mean, you see, so information is a new currency, a new treasure of the 21st century, and I'm giving you this information. And obviously, if you're smart, you will listen to me and take my advice. Obviously, not everybody's very smart or wise, so even if they receive the same information or advice, smart ones will take it, dumb ones will not. Hopefully, you're smart. Because there will be food shortage in the United States, most likely if the COVID crisis continues, I have recommended many days ago, weeks ago, that you should be purchasing at least 18 months of non-perishable food and storing it like in your garage or in your basement or in free space areas in your house if you are living in a condominium or apartment. And it is wise for you to take my advice, because what if food shortage starts? It's too late for you to get food because they're going to ration the food. As soon as officially President Trump declares, or your governor or your mayor declares there's a food shortage, they're not going to let you buy all the food. Right now, there's all this food you can buy. It's not rationed. So this is when you should buy 18 months of food and store it in your garage. Your car's not moving, right? Move your car out of the garage and put your food in there. It's not, nothing's happening. You could just park your car like in the curbway. And so If you're smart, you will listen to me. When there is food, get the food. When now, can you get more than 1 pack of toilet paper per visit? No, because they're rationing toilet paper. In the past, you could have bought 30 different packages of toilet paper and nobody would have stopped you. So be smart, get 18 months of food now, non-perishable. If COVID ends, you could donate all the non-perishable food to your local food bank. So it's not like it's going to go to waste. Or you could eat it because non-perishable will last you many, many years. So make sure you stock up. It's not like you have anything better to do. You're not going to work. So tomorrow you could go to your local grocery store. You know, I mean, you may not be able to get 18 months of food now in one stop, but make this week the week that you stock up to 18 months. Do some calculation and add some more, right? More is always good. If you run out, that's bad. So so this week should be go to shopping, food shopping every day, get food every day. My target goal is to get 18 months worth of food. Okay, do this because look, all these meat packing places are going belly up. They're closing not because there's no meat, but because workers are getting sick, which means you're not going to have Smithfield bacon from South Dakota anymore, right? So yeah, so if I were you, just tomorrow, this whole week, every day you go and get some food. Stock up. You and your husband start planning for 18 months. You don't know what's going to happen. Don't think it's going to stop. Well, if it stops, as I said, you could always give your food to the food bank or eat it yourself. Give it away as gifts. But this is not the time when you're thinking about, oh, what if COVID-19 stops and I have 18 months of food in my garage? This is not the time to think about that. This is the time to say how I'm going to prevent my children from starving to death 10 months from now if there's no food at Giant or Walmart. I mean, hopefully there's food, but we don't know. We don't know what's going to happen. Look at the way that hospitals do not have PPE. PPE is vital. Personal protective equipment is vital for survival for nurses. Nurses die because they get infected with COVID because they're reusing PPE. Did you know that you're only supposed to use PPE once? Meaning, and as you know, I'm doing my Master of Science in Nursing at Georgetown University with specialization in clinical nurse leader. I'm graduating in summer 2020 with my Master in Science in Nursing. So I am an expert, right? I mean, anybody who's doing a master's level work in anything is basically an operative expert or functional expert. And once I get my degree, I become a certified expert. So you got to listen to me on this thing. In every nursing textbook, first year nursing textbook, in infection protocol, you know what they say? You do not use glove with more than one patient at a time. Meaning, let's say I, as a nurse, and I do clinicals, nursing clinicals. I did it at George Washington University Hospital in DC. I did it at Children's National Hospital in DC, pediatric. I inserted a nasal gastric tube in a prematurely born infant that was like less than a pound when she was born. And because she could not take her food in, like, I fed her, the formula, and she was spitting it out. It wasn't going down. I had to put this nasal gastric tube. You could Google NG tube or nasal gastric tube, and you'll see what it is. And for infants, it's much more small than nasal gastric tube for adults. And babies literally this small, and you're trying to put it into little nose hole, which is like really, really small. And the tube itself is like really, really small, really, really thin. And, I was there, I'm a very good, nursing student. so I'm very good at these things, you know. so so you know, um, the nurse supervisor who was kind of watching me was kind of nervous, you know, and she's like, "Do you want me to do it?" I said, "No, no, no, no problem. This is easy, you know, easy peasy." You know, I didn't say that actually because the mom was there, the father was there, mom's father was there, the father's father was there, and they were a couple, you know, who had the baby, you know. Young, fairly young. You know, thank God they didn't kill their baby, but you know, they're good Christian family, both of them, their families, and so they're all sitting there watching me. You know, so can you imagine? I mean, you know, I'm very good at nursing skills, doing nursing stuff, so you know, it didn't bother me. I was kind of happy to have an audience, you know. So the mom, dad, you know, I think one of them grandmothers left because she just couldn't take it because she, she was afraid because you know there was tube going down the baby's nose into her stomach, like directly into her stomach. That's what nasogastric tube is. So there's a long tube that goes through the nose and then through your, you know, your tube all the way down to your stomach. And so the one of the grandmothers left because she didn't want to see that. But yeah, anyway, so I had an audience watching me, but you know my hand is steady as a rock, you know. And so with the little baby and the you know little thin tube, I'm putting it into the nose and then putting it in and in and in and in to the baby, and this long tube is going inside the nose and then goes to the belly. Uh, and then you know I did it like in less. I mean, I did it really quickly. I did it like at one shot. I didn't miss anything. No blood came out. The baby did not cry. That's how good I am. Baby did not even cry. The baby did not even know what was happening because I'm that good. I'm that good at nursing skills. You know, so don't tell my nursing professor I said this, but I consider all the patients who have me when I do my nursing clinicals as being blessed because I'm really good at what I do, you know. And so, but anyway, don't tell my nursing professor. I don't want them to think like I'm full of it or proud or anything like that. But I'm just being honest because I gave you proof, you know, with this nasogastric tube insertion in a little baby. I did it in one shot without a single mistake. Not a single mistake. It's a little baby with like the whole family watching, the mother, father, you know, one of the other grandmother left. I mean, and the nursing supervisor and another nursing person who wanted to see me do this thing. So I had all the whole like captive audience in a small hospital room in National Children's Hospital in DC watching me put this tube inside a little baby. The baby did not cry at all. Babies love me, you know. You know, my, you know, you know, I'm an elementary school teacher, and that may have something to do with it. You know, I'm very good at teaching elementary school. I taught at Savoy Elementary School in Washington, D.C., fifth graders before I started the Master's of Science and Nursing program at Georgetown University. And all of my kids love me. You know, and the kids are like, "Oh, Mr. Kim, Mr. Kim, give me a hug, give me a hug." I'm like, let's learn more math. No, but all the kids love me. I guess I have that special effect on kids. You know, kids just love me. So this little baby, the baby could not speak, but you know, obviously, you know, it's just born prematurely, less than a pound. Um, you know, and it's been a couple of weeks since birth, but yeah. So I mean, you know, the baby loved me. You know, I feed her and hold her. You know, and the baby just loves me. You know, and so yeah, but so yeah. So, but anyway, going back to what we were talking about, PPE, in the nursing textbook for first year nursing students, it says you should not be using gloves with more than one patient because you can spread infection. Even if you are taking care of the same patient, you use the glove when you enter the room, and you take care of the patient. Then you throw the glove away. Same thing with the mask. Same thing with the gown. You're supposed to use it once. And I've taken care of patients with HIV. I have taken, they're not as infectious as actually. You don't have to wear any kind of special precautions for HIV patients. But I've taken care of MRSA patients, and MRSA patients, they're highly infectious, and the bacteria is resistant to antibiotics. So generally, with MRSA patients, you have to wear a yellow gown, and you probably have seen yellow gown on TV. And in some cases, you have to wear a mask, depending on the patient. But you have to generally wear the gloves and the gown, and sometimes the mask. And so, but whenever you go in, you take care of the patient, and then you throw everything away. You throw the gown away, you throw the glove away, you throw the mask away. You don't reuse it. Because the problem is, when you use anything in a patient's room, bacteria sticks to the outside of what you're using. So if you go out of the room with that, you're bringing bacteria outside into the hallway of the hospital. So there are nurse managers who are monitoring the hallway to see if somebody comes out with the yellow gown or glove or a mask. And you could be fired if you do that too many times and you get caught too many times. And so you're supposed to use it in the room. You wear the clean one outside of the room. You bring so you're wearing clean, new, unused gown, mask, and glove. You go inside the room. Once you're inside the room, it's contaminated. And then you help the patient, and before you go outside of the room, there's a trash can near the doorway. You throw everything into that trash can, and then you come out without any of the PPE because they're thrown out. That way you control spread of infection in the hospital. So when you are using PPE more than once, definitely infection is spreading. Because how are you going to make sure that bacteria that's stuck to your N95 mask is not coming out with you from the room when bacteria and virus are sticking on the outside of the mask? Do you see the problem here? And so that's a serious problem with nurses and the use of PPE. That's why a lot of nurses are dying because they're getting infected. And more sad thing is, if they have to keep reusing the PPE, it's going to spread infection around the hospital. And that's not a good thing. And depending on the patient, you may be bringing other things out with you, like MRSA, which can be highly contagious, especially with vulnerable populations who are immunocompromised. And hospital has a lot of immunocompromised patients, meaning your immune system is down because of an illness, whether chronic or acute. Chronic means you had it a long time. Acute means you just recently developed it. So there are a lot of things to think about, tune in to a coronavirus update by Heerak to get information, to learn more about the healthcare industry, for future planning, because I have a lot of good advice, good ideas. As I said, I'm probably the most educated person in all of Virginia. Literally. So I probably have ideas that most people can't even start to think about, right? I mean, and information is power. Information can save lives, save businesses, save a lot of different things. So tune in and get some ideas, and hopefully this program will help you and your family survive. Now I have Mark chapter 5, 1 to 20 listed there. It's a story of a man who lives in a cave, in a tomb. Easter is a day when we recognize that Jesus has resurrected and the tomb is empty. And I thought it's kind of interesting because there was this Smithfield closes South Dakota pork plant due to coronavirus. That news was big news today on Easter. And the story that is famous in the Gospels with pigs is the story also of a tomb that became empty. There was a demon-possessed man living in the tomb, and Jesus drove the demon out of this man. And this man had so many different demons possessing him. It was called legion. So more than one demon can possess you, according to the Bible. And there is demon possession even now. And there are exorcisms being performed now. My dad is a Presbyterian minister. He performed many exorcisms. When he had a church in Philadelphia, one of our church members moved into a home of a family that used to be Satan worshipers. They didn't know it. Because can you imagine listing a house? This used to be the home of a Satan worshiper. Who's going to buy it, right? Maybe other Satan worshipers. But anyhow, there were residual demons in the house. So they didn't possess them because they're born again Christians. Excuse me. But they persecuted them. The deaconess of the church was literally lifted off of her bed and dropped. Actually, that's not how you're supposed to cover your mouth. That's how you're supposed to cover your mouth. But anyhow, seasonal allergies. It's coming. Hopefully the virus doesn't ride on Poland, because that would really infect a lot of people. But anyhow, and one of my close friends, he was telling us in the youth group that he felt the demon choke his neck, and he thought he was going to die. So my father, he's a very good senior pastor, Reverend Manu Kim, a senior pastor of First Korean Presbyterian Church in Philadelphia for a long time and retired. So we immigrated from South Korea to the United States because he had a call. A call is an invitation by a church for someone to be a pastor. So we immigrated, and he became a senior pastor at First Korean Presbyterian Church. And then he retired from that church, and now he's retired, but still very active in global missions. He and my mom, and they worked as a family. In Korean churches, generally, the women do not work, so they husband and wife, they work together in a church, and many Korean churches are very conservative, so they do not have female pastors, because there's a Bible verse that says women should be silent in the church, which is used as a prohibition from the New Testament for women ordination. So as you know, like in the Catholic Church, women cannot become priests because of this verse. So 1 billion Catholics around the world do not have a female priest because they follow the New Testament correctly, that women should not become priests. And the verse that goes that they use is women should be silent in the church. And that's the same verse that Protestants use as well. So you don't have any women preachers in Southern Baptist Convention because they want to follow the Bible. And my father is from Presbyterian Church of Korea, and they're very conservative. They don't ordain women either because they want to be true to the Bible. So Protestants, Catholics, they're united in not ordaining women as pastors if they're Bible following. If they're seriously following the Bible literally. And American counterpart, my father's denomination's sister church is sister denomination is Orthodox Presbyterian Church, it's OPC. And they don't ordain women either for the same reason. And Presbyterian Church in America, which is evangelical Presbyterian denomination, and there are a lot of Presbyterian Church in America churches in Arlington, Alexandria, Falls Church, and Fairfax County. They do not ordain women either because they follow the same verse that women should be silent in the church, and they believe the Bible is eternal truth, meaning same yesterday, today, and tomorrow. So none of these denominations are planning to ordain women ever until Jesus comes back, because they want to be faithful to the Bible. And Catholic Church doesn't ordain women, and they're right. From what I understand, Greek Orthodox Church does not ordain women either. So all the major Christian denominations which are serious about following the Bible literally do not ordain women as priests. It's God's house. You got to do what God wants. You may not like it. You may not agree with it. But you got to do what God wants, right? It's not your house. You do what you want in your house, but in God's house, you got to do what God wants. Obviously, it seems like God closed down his house, so no one can go in there, at least in many states. So maybe God was upset that women were preaching in the church when the Bible clearly says women should not be preaching in the church. Maybe that's the reason why, one of the reasons why God closed down the churches. Because how else would you explain if God is truly in control, wouldn't God find a way for worship services to continue in churches if he wanted to receive worship? And God does like worship, unless he's so offended at something. There could be several things that God is offended at, but one of the things that God could be offended at is all these women preaching in God's houses, which God doesn't want. So God's like, this is my house. I'm just going to shut it down. You're trying to do what you want, but this is my house. I'm God. Not me. I'm saying God is saying that. And God is just shutting down the churches because God doesn't want people to do whatever they want in the church. And so, you got to follow the Bible. If you're going to call yourself Christian, what's the point unless you're actually following the Bible? Because why don't you go and create your own religion if you don't like what the Bible is saying, right? People create religions all the time. But if you're going to call yourself a follower of Jesus, follower of the Bible, then you have to kind of follow what the Bible is saying. And one of the verses is women should be silent in the church, and you got to follow that. That's in the New Testament. It's not Old Testament. It's New Testament. People like to explain stuff away, but God has his rules. That's his house. Church is God's house. It's not a social organization where you could vote to change rules. That's not what church is. Church is not a democracy because Jesus Christ is king. Bible says kingdom of Christ. It doesn't say republic of Christ or democracy of Christ, right? It's kingdom of Christ. Jesus Christ is an absolute monarch. It's not a democracy. When Bible is given to us, God expects us to follow it faithfully. We can't change it by vote. And so anyway, going back to Mark chapter 5, verse 1 to 20, it's the tomb where this person possessed with demons, that's plural, many demons, Jesus drives them out. And the demons asked Jesus to let them go into the pigs. And the demons went inside 2,000 pigs. We talked yesterday about the significance of number 2,000. You can watch the episode from yesterday and the day before. Again, we see this significant number 2,000 coming out. It was 2,000 years ago, around 2,000 years ago, that Jesus rose from the dead, right? And numbers have meaning in the Bible. You have Trinity, that's 3. You have the disciples, that's 12. And another time we'll talk more about significance of numbers in the Bible. And different theologians have written about it in the past 2,000 years. So maybe we'll find the time to talk about that. But I'm hoping that your family will survive. We know that not everybody will survive. You may die. You watching this program now may die of COVID-19 before next month. We don't know. Only God knows, since He's in control. But you don't know. I don't know unless God tells me, right? How am I going to know? And so anything can happen. And so it's important for you to be right with God. And churches are shut. You can't even go to churches anymore, which are God's houses. It's not a social organization. It's not a social network, right? It's God's house, right? And we know what Jesus said about, house of prayer, right? God's house being a house of prayer. But God obviously does not want us to go to His house. He's locking us out of His home because He's not happy with things. So it's important for us as individuals to be right with God, but it's important for us as a nation and as a people to be right with God so that God lets us back into His house. God wants us to obey His rules in His house. And so women ordination of clergy should end. Any Christian denomination that ordains women should stop ordaining women. Because unless you want to create your own religion, go ahead and create your own religion. Just don't call it Christianity. Because Christianity that follows the Bible needs to follow the Bible. Bible says women should not speak in the church. You need to follow that if you're going to call yourself a Christian. And so we're in a crisis mode here. Churches are shut down. And if God's in control, God shut these churches down. Human beings may shut things down, but ultimately God's in control, right? I read through Isaiah and Jeremiah. Women ordination must stop. Catholic Church is absolutely right to not allow women to become priests because that's forbidden in the New Testament. And so, there's a lot of respectable things about the Catholic Church, and this is one of it. Preventing women from becoming priests is the right thing to do. They've done it for 2,000 years, and it's the right thing to do. And so if you're a Christian denomination, evangelical, doesn't matter. Evangelical churches can go far away from God. Or non-evangelical, Catholics don't ordain women, thank God. But whatever Christian denomination you are, you have to stop ordaining women because that's what the Bible teaches, God's rules, right? You don't create your own religion. I mean, you can create your own religion, just don't call it Christianity. Because Christianity is a religion that follows the Bible, God's word. And so the Catholic Church is right not to allow women to become priests. It's a very important rule that all the Christian churches must keep. And so I say this as someone who has relatives who are female pastors, just to share with you, because, full disclosure, my mother's side comes from a very liberal Presbyterian denomination, which is a sister denomination with Presbyterian Church USA. And my father comes from a very conservative Presbyterian denomination. So we have relatives who are Presbyterian pastors on both sides, conservative and liberal. And on my mother's side, there's dozens of Presbyterian clergy. If you include like second cousins, third cousins, hundreds of Presbyterian clergy. And some of them are women. Like, for example, the first women pastor in the United States of America who's of Korean descent is my mother's aunt. She came to Baltimore and had a Korean Presbyterian church where she was the pastor for a long time. I have hundreds of relatives in Baltimore area from my mother's side. And many of them, are in the military or in FBI, Homeland Security, these agencies. The very first Korean sergeant in Baltimore Police Department was my uncle, not like my mother's brother uncle, but my mother's cousin uncle. Actually, I think he might not have been my uncle per se. It's like my mother's uncle. So it would be like my grand uncle. Yeah, I'm not sure what the technical term would be, but he was the first Korean police sergeant in Baltimore Police Department. And I think I'm not sure if it's in the United States or not. I'm not sure about that one. But I know that the first Korean woman pastor in the United States was my mom's aunt. And so, so you can imagine a lot of female Presbyterian pastors have come out through that side of the family. No offense to my Baltimore relatives or Maryland relatives, but yeah. But anyway, still, it's wrong. But anyway, so just to let you know, it's not like I don't understand the situation. I like her. I've seen her many times. Because whenever when we visit Baltimore, hang out with the relatives there. But anyway, yeah. So let's follow the Bible, and let's be right with God, because obviously things are not right in the United States. And we cannot say it's just a virus. There is a spiritual dimension to everything. We cannot ignore the spiritual dimension. We cannot say this is just biological. We have to think about what's going on spiritually, and what must we do spiritually to bring things back to homeostasis, to borrow like a nursing term, or equilibrium, or normalcy, to use the more of a popular term again. And if God is in control, and he is, he's not going to let things go back into normal conditions until he is relatively satisfied. And that means we have to start doing things that's going to make him happy. And because God is all-seeing, all-powerful, you cannot hide from God. You cannot fake it. God sees everything. God knows everything you think, what everybody thinks in the world. So we got to start bringing the Church of Jesus Christ back to the position that New Testament wants. And one of the things that we have to start doing is stop ordaining women. And women who are ordained should no longer be allowed to practice as clergy, just because we need to go back to the New Testament position on ordination. Jesus did not have any women among his 12 disciples. At a time when there are a lot of priestesses. It's not like in other religions there weren't priestesses. You've heard of the Vesta virgins, priestesses of Roman gods, Greek gods. There were priestesses everywhere. In fact, some may say there were more priestesses than priests. There are more female priestesses than male priests at the time of Jesus Christ in other religions. But there were no female priests in ancient Israel and in Judaism at the time. Jesus refused to have any clergy who's women at that time. And that continued on to the early church. And it continued on for 2,000 years. And there's a reason for that. And in the New Testament, St. Paul clearly says women must be silent in the church. And that's the rule. And so it's not like Jesus lived at a time when women were not priests. There were a lot of priests who were women in other religions, just not in Christianity. And Jesus forbade it. God forbade it through the Bible. And so, that rule has to be followed. So that's something that everybody should think about, especially if you're at a church with a female pastor. You all need to think about that, because we need to be right with God, and being right with God includes following God's rules in His house. That includes your local church, the church that you go to. We have to start following God's rules, because it's His house, it's not your house. Anyway, I hope you will think about these things. The spiritual things matter. And we are experiencing serious problems right now. So it is the right time to think about these things. We need to be right with God so that God will make the world normal again, right? God's the creator. God is sovereign. God is in control. He can do this overnight if He wants to, right? I hope your family will be well, you will be well, and I hope that you and your family will survive COVID-19.